Hello, Medipreneurs. We are here with Kelly Eplen. Kelly is going to be speaking on Saturday morning, in particular to intrapreneurs. And she is talking about getting outside the proverbial box, a pharmacist's guide to innovative service development. And oh, you're the queen of innovative service development. Can you tell us a little bit about your session?
Sure, absolutely. I think that anyone who really wants to capitalize on opportunities for pharmacy service expansion within their current practice setting is somebody that should attend. If you're not exactly ready to branch out on your own, or if you feel that there are opportunities that exist, but you just don't know how to start, I think that this session is really going to foster that type of discussion and spark the innovation that you're looking for.
Excellent. A lot of times your session, the equivalent of your session, is attended by people who they're great clinicians. They practice in healthy settings, whether it's health systems or independents or chain pharmacy, wherever they are, and they just have this inkling that they can do something more.
Mm-hmm.
And I think that's who you'll have in your audience. So what might they take away from to having the 90 minutes with you?
Yeah, I think that's exactly who should attend this session. I think the key takeaways for me are, things like, what are the key drivers for service expansion? So why do you think that these opportunities exist, and why haven't you taken that next step? So looking at things like value-based performance opportunities, transition of care, quality benchmarks, and how do you work within your box or your organizations, knowing that there are those organizational constraints to expand services and capitalize on some of those lower hanging fruits. I also want to talk about some common barriers because, I have, as you alluded to, I have helped develop and implement ambulatory care services at multiple organizations, and there's always common barriers. So really fostering some discussion as to what types of barriers people have been faced with, and then hopefully offer some solutions and ways that they can overcome those barriers.
Oh, that sounds fantastic.
Yeah, it does.
So tell us a little bit more about your story. What led you into AmCare Pharmacy? I know through American Society of Health System Pharmacists, you've had a lot of leadership in this area, and there are a lot of young practitioners who I think could raise their hat to you as opening many doors to them. So give us a little history.
Sure. Well, my current position, I'm the Associate Dean of Student Affairs and Admissions at the Winkle College of Pharmacy at University of Cincinnati. I have only been in this position since January of 2019, so just over a year. Prior to that, I joined the faculty here in 2009, and I've been an ambulatory clinician since I graduated. That was the niche for me. I knew that I did not want to practice inpatient. I wanted to have that relationship with my patients, an ongoing relationship, and to be able to utilize an expanded scope of practice. Ambulatory care kind of fit that mold for me, and it was just something that really, I've been passionate about my entire career. So I started at University Hospital in Cincinnati. I developed a pharmacotherapy clinic and an anti-coag clinic. And it very quickly became my niche to develop and implement services within the health system setting. So obviously University of Cincinnati Medical Center has a lot of well-established clinics, but at the time there really were no pharmacist-led clinics. And so that quickly became a need, and I saw a need and was able to work within the constraints of the organization to develop those ambulatory services. After that, I kind of branched out into community health systems. So St. Elizabeth Healthcare in Northern Kentucky, really, it actually at that time was part of the Health Alliance, was in collaboration with UCMC. So I took that opportunity to then move to the community health systems and just replicated what I had done at University Hospital. So it's doable, and there's so much opportunity. So for those, I always thought that, I had these innovative thoughts, but I wasn't really sure how to get started. And unlike you, you guys are kind of my heroes that took the leap, and similar to some of the other speakers where they've started their own companies. Just sharing some personal information. I have 4 kids, and they're 2 years apart. And so trying to follow through with some of those innovative ideas, and going out on my own was just not a possibility. And so I looked for ways to innovate within the organization for which I was practicing. And so it's been a really fulfilling career. I think that anybody that is an entrepreneur, there are opportunities out there to be innovative, and expand your scope. So that's really what I want to talk about.
And I think the time is right. Pharmacy's changing so dramatically, and I know you're seeing that as a practitioner and as an academic. Mm-hmm. So you're the right woman at the right time to talk about some of these things.
Yeah, I think everybody asked me, as a practitioner for so long, why I made the leap to academia and specifically administration. And, it was time for a change for me professionally. And I think we all see some of the negativity in people that are practicing right now. And, in certain sectors, we see, we have preceptors that are actually telling our pharmacy students not to go into pharmacy. And that is something that we just can't allow. And so part of the reason I wanted to go into academia was to really share my passion about our profession, share the opportunities that exist, and the change that's occurring in our profession is so exciting. It's a wonderful time to be a pharmacist, and that's really why I went into academia.
That's beautiful. I agree completely.
Mm-hmm. Yep. It is the best time to be a pharmacist.
It is. Actually, yeah, we had, the changes, OPA, the Ohio Pharmacists Association, we had Stu Beatty come in and speak to our students last week about provider status in Ohio and some of the other states that have achieved provider status, and some of the pilot projects that are going to be occurring. And, it's opportunities like that to have those discussions that really re-energizes me. And that's part of the reason why I want to do this conference, is that I think that, that there is so much opportunity out there, and to engage at the state level, to expand our scope of practice, and to be, some of these pilot sites. I think that, those are perfect opportunities for entrepreneurs. They can, they don't have to go out necessarily on a limb on their own, but they can, work within their organization to capitalize on some of these opportunities.
Agree. And I hear so much hope in the way that you're describing that. And I think a lot of pharmacists have lost track of that. So this will be even for those people that kind of doubt that pharmacy's headed in a good way, we're going to invite them to come along and listen and feel the energy of Medipreneurs, feel the energy in a presentation like yours.
That's great. I look forward to it. I'm really excited.
Well, we will see you in April.
Okay.
Community also, I just want to say that's why we are building this community, to offer support and experience and expertise like you and other people, just to give people the confidence to be able to use those innovative thoughts that are going through their mind and actually begin to push them forward and implement them.
That's great. And I'm hoping that's what they take away from this. I think it'll be really useful information to then expand their practice.
Absolutely. Well, thank you. We'll see you in a few weeks.
Absolutely. Thank you. Have a great day.
You too.